Good morning and afternoon to everyone. Bonjour à toutes et à tous. Thank you for joining us today. I'm here to talk to you about Health Canada's authorization to permit Pfizer BioNTech to change the product monograph and label for their COVID-19 vaccine to reflect that each vial contains 6 doses of vaccine rather than 5. As you're likely aware, Health Canada initially authorized the Pfizer BioNTech vaccine on December 9th, 2020, with 5 doses per vial. This reflected the information and proposed labeling data submitted by the company at that time. I'd like to provide you with some information about today's authorization, as well as our work with the provinces to advise them of this change, and to ensure healthcare professionals have the support and supplies they need to implement it. The authorization included changes to the product monograph and label for the Pfizer-BioNTech COVID-19 vaccine following an independent and thorough scientific review of the submitted information. In the review, it was determined that 6 full doses could be obtained reliably and consistently from each vaccine vial. Health Canada had previously been informed that it had been possible in some circumstances to obtain a 6th dose from each vial. However, in order to extract a 6th dose reliably and consistently, a specialized syringe should be used. A low dead volume syringe is designed to have a lower volume of liquid that stays in the hub of the syringe after the vaccine is administered. This minimizes the loss of vaccine volume per vaccination. With this label update, it's important to note the volume of vaccine in each vial has not been changed. Just like other international regulators, Health Canada requires that vaccine vials include a certain amount of overfill per vial to ensure that there is sufficient volume to extract the expected number of doses. Based on its assessment, Health Canada has determined that each vial will reliably contain 6 doses of vaccine plus sufficient overfill volume when proper technique is used. Other countries like the US and the EU have also implemented similar changes to allow for the use of 6 doses per vial. As part of the authorization, Health Canada has issued terms and conditions to Pfizer-BioNTech. They are required to provide continued educational support as needed to vaccine points of use in Canada to facilitate implementation of the 6 doses per vial label change. The company must provide information regarding low dead volume syringes and needles and the process for ensuring the accuracy for low dead space. They must work closely with Public Services and Procurement Canada to support them in the procurement process, if required, and support implementation with provinces and territories. And they must provide Health Canada with a quarterly report on product complaints so that we can know if administration sites have any issues with the extraction of the 6th dose. With this authorization, Pfizer-BioNTech is also required to inform Health Canada within 24 hours of each current site receiving their first shipment of supply with the new label change. As part of this product monograph label update, Health Canada has also updated the information about allergic reactions. While the product labeling already included clear warnings about the possibility of allergic reactions, it's now been updated to reflect that very rare severe allergic reactions, including anaphylaxis, have been reported during mass vaccination outside of clinical trials. A severe allergic reaction would usually occur within a few minutes to 1 hour after getting a dose, and Canadians can be assured that this new information does not change the benefit-risk profile of the product. We continue to recommend that people who are allergic to any of the ingredients of the authorized vaccines or who have experienced an allergic reaction to a COVID vaccine not get the vaccine. People with concerns about any other types of allergies should consult their healthcare professional. The updated product monograph and supporting documents on both the labeling changes are available on our website at covid-vaccine.canada.ca. As this label change is being implemented, the Government of Canada is supporting provinces and territories by making a sufficient supply of low dead volume syringes available in time for the first doses of vaccine distributed with the new 6-dose labels. Major General Fortin will speak more to these details later. You can be reassured that the Government of Canada is doing everything it can to equip our healthcare professionals with the right tools to vaccinate Canadians. Vaccination continues to be a key element of our response to COVID-19, but we need you to remain vigilant and to continue to do your part, which means wearing a mask, washing your hands, and keeping your physical distance. Thank you. Merci.